once again to another podcast episode of the African Union Development Agency. We call it Conversations on Africa's Development. Today we have another exciting guest on our show. Her name is Dr. Margareth Ndomondo-Sigonda, who is the head of Health at the African Union Development Agency, NEPAD. We're looking forward to a great conversation on health, on COVID, on what the organization is basically doing around curbing or trying to come up with solutions on this issue, this pandemic that has gripped the continent. Dr. Sigonda, welcome to the show.
Thank you.
Okay, Dr. Sigonda, firstly, tell me more about this health program. What is it that you do? And based on that, what do you think are the prospects for the continent around your program, around what AUDA NEPAD is doing?
Thank you. As you may be aware, that AUDA NEPAD is a go-to African Union institution that has been mandated to oversee the implementation of the Agenda 2063. And one of the aspirations under Agenda 2063 is to have healthy population and well-nourished people.
Okay.
And that basically is aiming to contribute to the overall goal of making sure that we have a prosperous Africa based on inclusive growth. Okay. And so in view of that, you realize that it's very important that as AUDA we play a role in advancing public health initiative to contribute to the development agenda.
Okay.
And so how we do this is by implementing the various AU policy frameworks.
Okay.
We have one which is the African Health Strategy, which was endorsed to guide African Union member states on how and the priorities when it comes to public health programs.
Okay.
But also we have the Pharmaceutical Manufacturing Plan for Africa, another policy framework that advocates for promotion of local production of medical products and technologies.
Okay.
We are also attributing to the STIZA, this is the Science, Technology and Innovation Strategy for Africa, which basically is focusing on investment in research, development, innovation.
How's that research going on the STIZA? How is it going?
There's a lot that is going on at the moment, and this has been going on for quite some time. But I think when the AU endorsed the STIZA in 2014, basically it brought to the fore the aspect of better coordination of these, R&D and innovation initiative. But we have quite a number of initiatives that are geared towards advancing research and development and innovation on the continent with a view to address the health challenges that the continent is currently facing. As you may be aware, the continent actually is home to 15% of the global disease burden. And, that in itself is a lot. And if you take into account the weak health systems that we have on the continent, that brings it, it makes it difficult for us as a continent to be able to address our own health challenges, and therefore the need to have innovative way of addressing our disease burden that is affecting the continent.
Dr. Margareth, you spoke about something, the weak health system. Now, people say COVID exposed Africa's weak health system. There are those pessimists who say COVID really caught us off guard. What do you have to say about that? How did AUDA NEPAD gear up to try and lobby the whole system, the health system, to try and curb or try and handle this whole COVID pandemic?
So when it comes to health systems, in its holistic way, we are basically talking about the infrastructure, We are talking about, when I talk of infrastructure, I mean the hospitals, health facilities, and so forth.
Okay.
We talk of the availability of human resources. We talk of financing of health care. We also talk about availability of medical products, but also we talk about health information management system to assist, governments to be able to know, to have records as to who is getting treatment for what, so at least the health information management system is also very critical as part of the broader package of health system strengthening. And so when I mentioned about the weak health system, it's because most of the countries are still struggling because they don't have very robust systems, and therefore the need for us to really get to a point where we advocate for more investment on health. That is what's needed, because COVID has exposed us in a way that most of the countries, they found themselves that they are not able, for instance, to do the necessary testing that is needed for them to be able to diagnose if a patient has COVID or not. Okay. Most of the countries were not able to do that. But in addition to that, even where you have, those tests done and you're able to identify, diagnose the cases, most of the facilities did not have the necessary equipment or medical supplies that are needed. You remember the issues around protective, personal protective equipment. Most of the countries struggled to actually have that. And
who's to blame for that, Dr. Margareth?
I think, to me, what I'm seeing as a key problem is, I think, to do with how coordinated we are in terms of implementing the various policy frameworks. Remember, I didn't tell you about the policy frameworks that we have.
Yes.
But I think our biggest challenge is when it comes to implementation. For instance, if you look at the Pharmaceutical Manufacturing Plan for Africa, it was adopted by the AU Assembly in 2005. And in that policy framework, it's very clear as to what is needed for Africa to be able to self-sustain its own medical supply needs. It's very clear. The need for infrastructure is elaborated in there. The need for market access, financing, the need for research and development infrastructure, IP infrastructure, and all that. But I think the challenge has been the implementation part of things, to say that one is we don't, put our money where the mouth goes. We don't invest in the implementation of those policy frameworks, and we rely heavily on donor funding, and that is our biggest challenge. And that's the reason why you realize that now COVID-19 has hit the continent, of course the globe in general. But you see, we have been so reliant on medical supplies from abroad. We import more than 70% of our needs on the continent, and largely from India. Now, during COVID-19, you have a situation where you have borders are closed. India is not exporting to Africa, and other countries that are also supplying Africa. And then you have these supply chain disruptions, we have shortage of supplies, and that's where we realize that something went terribly wrong that we need to correct.
And what is the stance of AUDA NEPAD around this whole dependency on the West, on the East, on everybody else without being self-reliant? What is your stance as the head of health? So
COVID-19 has really helped us to reshape our thinking in the way we're addressing health issues. One thing is to understand the fact that health is a development issue. Good health leads to development. If you don't have healthy people, you cannot develop. And since the COVID has largely affected economies of many countries, including the donor countries, so naturally you realize that funding for health was also affected,
yes.
Right? And so what do? So we have realized that first and foremost, we need to continue advocating for investment in research and development, so that we're able to get products that are able to address the needs of our continent, the diseases that are affecting our continent. As I mentioned, we have a very huge burden of disease. That's one. But secondly, we're looking into coming up with innovative financing mechanisms for health. instead of relying on donors, while we know that already donors are reducing their contribution to Africa, that the African leadership, during its meeting, for instance, that was done in February 2019, had actually made a decision that we need to really find innovative way of financing health through domestic finance. And so NEPAD agency, AUDA NEPAD, was given mandate to provide oversight and coordinate that. So we are busy working with the regional economic communities to establish the so-called regional financing hubs. The idea is that we should be able to really track progress when it comes to government contribution to health spending.
How far are we with that? So from 2019, how far are you with that?
So far, we have engaged East African community. They are very well advanced, and in the SADC region, they are very well advanced. And we are at a stage where we are finalizing the tools to track progress when it comes to health financing. And we hope that through these tools and through these engagements with the RECs and countries, we will see more investment on health coming up as we move forward. Yes.
Okay, that's good to hear that there's progress there. Now tell me about this AU3S. Tell me who's leading on it, what is it about, what benefits, what value does it add to ordinary African citizens?
So the African Union, the AU3S stands for the African Union Smart Safety Surveillance. This is a program that was initiated way back in 2019, once again, to address the problem that we've had in terms of monitoring the safety of medical products across the continent. And so when it started, we didn't have COVID-19 yet then, but when COVID hit in 2020, early 2020, we had to repurpose the program so that it would address the COVID-19 challenges that we are facing. So this program is currently being piloted in Ethiopia, Ghana, South Africa, and Nigeria. And what it does is really to assist countries. Now, the focus is COVID-19 vaccines. We are assisting countries to have a robust system for monitoring the safety of vaccines, right? In a way that we're using electronic platforms to capture data, and countries are able to analyze the data and determine if there is any signal that whatever side effect that the patient is getting is due to the vaccine or not. Yeah, because the problem that we've had, most of the countries were using manual systems, and that made it very difficult for data capturing. So now with the electronic platforms, we are able to capture that information, and you know, the analysis is done, and countries are also able to share you know, information about signals, if there is any signal of an adverse event that has been detected based, you know, on a use of a vaccine, then they are able to share and determine whether there is really a relationship between the side event and the product.
When are we going to the average person wants to know, okay, I'm doubtful about the vaccine, for example. I'm just speaking on and I want this app. When is it going to be ready? So
the app is already up and running. Yes, there is an app that is running, and that actually, so you can just download it and put it on your phone, and then it will give you some direction as to what you need to do if at all you have you know, experienced any untoward event after the use of a COVID-19 vaccine, for instance. Yes. So the app is available, especially in the 4 countries that I mentioned. Yes.
I think it's a major stride that people need to know about. You know, the fact that it's led by the AUDA NEPAD. So
it is.
I think thumbs up to yourselves on that. So tell me. I said earlier, skeptics are saying COVID exposed Africa. Now, optimists are saying COVID pandemic also, in a way, is an opportunity for the continent to thrive and showcase its innovation. What is your stance? What do you think?
But when it comes to COVID-19, it's true. It exposed us, but at the same time, it is really an opportunity.
Okay.
And there's that realization that Africa has to put its house in order.
Okay.
And it's time for public health order. And I remember the director of Africa CDC when he was making the remarks when we were launching the partnership for African vaccine manufacturing. It was very clear that it is time for Africa to put its house in order. And so what we have done so far, maybe I should start with what AUDA is doing. So AUDA has continued to engage its partners. I did mention about the STISA policy framework, and there's quite a number of partners that are busy working on finding new solutions for diseases that are affecting Africa.
Okay.
We have the Neglected Disease Initiative, MDI, that has been working on identifying the medical products that are aiming to address the diseases that are affecting Africa. Is doing a lot of work in terms of research on neglected diseases. But also we have research and development hubs. We have, for instance, Kenya Medical Research Institute is doing a lot in terms of developing medical products. Even South Africa has a lot of R&D that is going on, and we also have we are also engaging, for instance, EDCTP. Through the funding from EDCP, we are getting a lot of research going on to develop new products, and also the African Alliance for Innovation, AESA, is also doing a lot of work to come up with products. So that is on the front of research and development and innovation. But in addition to that, we have also embarked on an extensive manufacturing framework. And we are working, for instance, with Africa CDC to advance vaccine manufacturing for a start, to be able to address the continent's need. The goal is to make sure by 2040 we are able to supply 60% of the vaccine needs of in the continent. Yes. So basically, we are working on that, and there's a lot of work that we are doing, for instance, as AUDA in NEPAD, to make sure that we provide an enabling environment for vaccine manufacturing, including other products as well. So we have an initiative, for instance, that has been going on for many years, since 2009. This is the African Medicines Regulatory Harmonization Initiative that is working with regional economic communities to provide...
Tell me about the TB program as well, Dr. Margareth. What is happening there?
So in the TB program, we've also been assisting countries in the Southern African region to strengthen their systems for control of TB program. We've also we've been working also under the TB in the Mines project to address issues that are affecting mine workers. And through this initiative, we've been able to establish it's 11 centers for these are the centers, we call them occupational health and and services centers that are aiming to assist countries to be able to address work-related challenges that people are facing in the workplaces. And this program has been very instrumental to not only establish those centers, but now we are busy working on how best to sustain those initiatives in a way that we'll be able to scale it up to other countries across the continent. Yeah.
Yeah, I must say it's, we are learning a lot. The things that you've spoken about, I think AUDA NEPAD can proudly say that it's taking up its space in this fight against COVID, but also in having a healthy continent. Now, I want to ask you personally now, remove your AUDA NEPAD head.
But before we go there, I just wanted to finish something. I was talking about the MRH initiative, you remember? And I was saying we've worked with the regional economic communities. We have been able to address quite a number of issues when it comes to ensuring that products that are circulating in the market are safe, of good quality and efficacious. We have designated 11 regional centers of regulatory excellence that are supporting countries to improve their capacities. We have also been able to advocate for adoption of the African Union Model Law for Medical Products Regulation. 17 countries have domesticated that. We've also been able to come up with to propose a treaty for establishment of the African Medicines Agency as an offshoot of the MDI Initiative. As we speak now, we already have the 15 ratifications that are needed. We are just waiting for the deposit of the instrument of ratification so that AMA can come into force. And the African Medicines Agency is going to play a very critical role when it comes to really removing technical barriers to trade and facilitating research and development and local production. I thought I should also mention that as a way of really addressing the things that we are facing currently as a continent. Yes.
And you are working with African Union?
We work with the African Union Commission, the World Health Organization, to advance the African medicines agenda. Yes.
That's good to hear. And I know MRH is quite a old program, so it's one of NEPAD's babies and pride.
Very true, very true. No, we are very thankful. At least we've been able to have an institution born out of an initiative. Yes.
Now, so I need you to remove your NEPAD hat, and as an African citizen, what hopes do you have for the continent? What do you want to see? What is the Africa that you want to see, Dr. Margareth?
So this is what I want to see for Africa, that you have people that are committed to advance the interests of the continent. The reason being that no one will do it for us as Africans. It doesn't matter how much money they give you. All those things that they, whether it's donors, they come and give you money, there is always a condition attached to it. So we have to be mindful, we have to be on the know, we have to be awake, so that we know what we stand for as Africans. And so my wish is that we should be really Pan-Africanist to make sure that we advance the interests of the continent and contribute to the development agenda of this continent. That is my wish. And I'm hoping that, especially for young, professionals and, the younger generation, that they should have that in mind. It's not just running for money, but more looking at what values do you stand for as an African, and what contribution are you making to make this Africa a better place. Yes.
I think I will take that advice as well. Dr. Margareth, thank you so much for your time, and I hope our audiences out there have heard about the numerous things that we are doing under your program, your health program, and I hope it will also, those people that are doubtful out there about the role that AUDA NEPAD plays in this health chaos or opportunity that we might be in. I hope that they realize that there's a lot that's being done in the background and on the forefront.
Very true.
Yeah.
Very
and
true.
Thank you very much. Well, you've heard it from Dr. Margareth Ndomondo-Sigonda. She says that we need to continue being Pan-Africanist in our approach to development. We need to know our value, and she says that we need to understand that aid is not necessarily the answer to Africa's development or Africa's problems. There are many other ways, and earlier she spoke about domestic resource mobilization as well. So I hope for our audiences out there, you are learning a lot from this expert with a lot of knowledge. And thank you very much once again, and we hope to see you at the next Conversations on Africa's Development podcast series. Thank you.